Half of all adults with mental health problems report experiencing first symptoms under the age of 14. In the UK alone, 1 in 10 children aged 5 to 16 already has a significant mental health problem. These might be behavioural or emotional in nature or both. The costs of mental health problems are very high. For example, by adulthood, a child with a significant conduct problem costs society 10 times more than a child without this kind of difficulty. Current first-line therapies for behaviour problems help only half of the children seeking help.
The Wirral Child Health and Development Study was established to identify new early risk and protective factors for childhood behaviour problems over time. We hope that our findings will lead to development of new treatments and also the better targeting of new treatments.
The Wirral study reflects a successful 10-year collaboration between 4 universities, led jointly by Professor Jonathan Hill at the University of Reading, myself, Professor Helen Sharp at the University of Liverpool, and Professor Andrew Pickles at King's College London. The work has been funded by the Medical Research Council from the beginning.
In 2007, we recruited over 1,200 pregnant women and their partners. We have followed these parents and their child's development at regular intervals from pregnancy to age 9 so far.
All of the families originally lived on the Wirral, but now we have families living all over the UK and in 10 different countries worldwide. From their time in the womb, we have assessed many aspects of each child's environment and their development, with the help of parents, teachers and direct observations and tests in our Child Development Centre. For example, we monitored and observed each child's temperament, how different children react to frustration or new situations, and how they manage waiting. Early social experiences with parents and then later with friends in school are also very important. So we assessed how children and parents manage early separations, misbehaviours and problem solving, and we asked children about friendships and experiences of bullying. Finally, as all children have to cope with stressful events in their lives, we measured their response to stress through heart rate monitoring and the level of stress hormones in their saliva.
By the age of 7, over 16% of the children in our study have clinically significant emotional or behavioural problems, as reported by either their teacher or their parent.
We have discovered important aspects of caregiving that can reverse adverse effects of exposure to stress in early life. And we've discovered that responses to stress vary for boys and girls, leaving them susceptible to developing different types of child mental health problems. We know that boys are more likely to have behaviour problems during childhood and early adolescence, and girls are more likely to develop depression in adolescence. Going forward, the Wirral study is perfectly poised to understand how different factors work together in the development of depression and what protects young people from these risks.
Over the past 10 years, we have worked hand in hand with many different community organisations and of course with all the families who have generously taken part. We would like to say a really big thank you to all of you.